Everyone. I'm Rahul Nanuhal, COO at Cureka.com. And we are back with our weekly Instagram live session with a specialist doctor to take care of a very niche and special concern that most of us are facing in today's world. Today's specialist doctor is Dr. Shanmuga Priya. He is going to join us in just a while. She is an expert dermatologist and cosmetosurgeon who takes care of all your skin care and hair care problems. At Cureka, we have been doing phenomenally for the past couple of months because of all your love. We have grown strength to strength, and now we have reached 10,000 plus orders in just about a month. Our overall reach has expanded to more than 10,000 pin codes in India, which we are covering across all 28 states, across 7 union territories. So Dr. Shanmuga is going to join us. I believe doctor is just going to join us now. Good morning, doctor. How are you?
Yeah, I'm fine. Good morning.
Great. Thank you so much for joining us.
Okay.
So the topic for today's discussion is hyperpigmentation.
Yeah.
So doctor, let's start with our first question. What exactly is hyperpigmentation and what causes it?
So I just want to start this with the basic. Okay, so is the audio clear?
Yeah, absolutely clear. Yeah.
Okay, so this we all would know that we each have a different tone of skin color. So like what we all have in common is we all have a pigment called melanin in our skin cells. So this gives the density and the type of melanin determines what type of color we'll be, whether we are going to, what shade which we are going to be. So, but the pigment melanin is universal, it is present in all. So, like skin has many cell layers, like how we build a wall, brick wall, we layer the bricks one over the another. So skin is made up of such layer of cells. So the deepermost layer of cell is where the pigment cell is present. So for every 10 normal cells, there is one pigment producing cell which is there. So this is going to give pigment to the cells above. So the other cells will be producing new cells and sending them above. And this pigment producing cell will not produce a cell, but it will just produce pigment. It will make it in a tiny packet like, and then that's applied to the cells above. So the cells, they are determined what color they will have when they are produced at the basal level itself. So these cells, when they keep moving to the top, the color starts to show on our skin. So this is important because to understand why we have pigment, to understand how to treat that, and to understand how long we should wait for the results to appear, we should know this, because this cell which contains this pigment has already had this pigment from the basal layer, it's moving to the top. This period takes about 1 month. So any injury or any inflammatory skin conditions like pimples or any suntan, this can increase this pigment production by these pigment cells, and it gives more than usual pigment to the above cells. So this cells with the more pigment starts to come up, and we have all these dark patches, dark spots and everything. So if we start treatment for pigmentation, still we have to wait for this cells, the already packed cells with pigment to go off, and then so that the new cells which come do not have that abnormal pigment. So pigmentation is just abnormal pigment concentration. We all have some amount of basic pigment concentration. When it goes above something abnormal, then we have like a uniform increase in skin color, or we have a patchy uneven skin tone.
Correct. Right. So guys, those of all who are joining in just now, you can ask your queries to Dr. Shanmuga. Please mention your questions in the comment section below, and we will take them up during this Instagram live session. In case if we are not able to cover it up, we will be consulting the doctor once again with your queries and come back to the responses within Instagram comment section below. So you can also view these videos on YouTube because they're posted on YouTube as well as Instagram as well. Now coming back to this hyperpigmentation, doctor, it affects a lot of people, their personal self-confidence, the ability for them to feel confident or mature in a situation because of this hyperpigmentation. So is there some home remedies to avoid pigmentation, or is it something people can do to avoid these patches of dark skin that they might get from time to time?
Yes, so there are many causes of pigmentation. So the most common being a pigmentation deepening because of sun exposure. So if you're not ready for treatment, but if you want to try something at home, the first step would be to protect yourself from UV rays. So the first product everybody will need to select will be a good quality sunscreen. So that is like an investment if you want to have a pigmentation, a regular normalized pigmentation skin. So because that basically assesses the, addresses the root cause. So sunscreen would be important part of any home care, skin care, or professional skin treatment for pigmentation. So this is the first one. The next would be to avoid the causes which can produce this pigmentation. So one is UV, but others would be many inflammatory skin conditions like pimples or a dandruff which we have on scalp that can also commonly occur in face, but it presents differently. Some people have this pigmentation around mouth area, so that mostly is dependent on that. So by controlling your basic skin conditions like pimples and dandruff under check, so we can prevent an pigmentation because of that. Other causes would be your diet. So what can be done at home is have a diet which is very good in antioxidants. Like by antioxidants, I mean all kinds of colorful fruits and vegetables which are loaded with antioxidants along with nuts and seeds. So whatever the damage which happens because of sun exposure in spite of sunscreen use or without sunscreen use, and also because of all these inflammatory conditions, this antioxidants can come to some extent kind of decrease the effect of this and can control the pigmentation level. So diet with a high antioxidant intake would be another thing which you can do at home. And the fourth thing someone can do at home is a regular exfoliation of skin. Like I said, the pigmented cells which contain this abnormal pigment, they sometimes tend to retain that. So if we can just normalize your cell renewal by exfoliating the dead skin layers, so the newer cells which can come up can have some normal pigment. So exfoliation is something which can be done at home. If it's mild, we can do it thrice a week. If you're going for a higher level, you can do once a week.
Okay, right. So doctor, what are the different types of hyperpigmentation and how do they differ?
For a dermatologist, the first two types would be whether the pigmentation is in the top layers of skin, epidermal, or the pigmentation is deep down. So that is how we differentiate how our treatment is going to be. So if the pigmentation in the top level, which is very common, the common type, we can use all kind of skin lightening agents. The professional treatments like peels, lasers, and everything can help this kind of pigmentation. And even home skincare can kind of lighten this pigmentation. The other deep type, where the pigment sometimes the pigment cell itself gets destroyed due to many skin conditions or hormonal imbalances, or sometimes due to some chemicals in our skin care or environment. So that time the pigments, instead of getting packaged into the cells above, it kinds of deposits deep. So that type is very difficult to treat with even with good creams and anything. So that would need laser treatment and professional consultation. So this is how we differentiate pigmentation. For the common people, you can also differentiate based on the causes. So they can have a diffuse, even type of pigmentation all over the face, or they can have patches or they can be just spots, blemishes like sunspots or spots following some pimples, or they can be localized like around eye area, under eye dark circles, or around mouth, perioral pigmentation.
Right, right. So, doctor, what are the common triggers for hyperpigmentation in individuals?
Yes, first trigger, as I said, would definitely be UV rays, and also now we
UV
find that
rays.
even visible light and even the blue light from our devices can increase pigment production to some amount. So the first would be the light. The second would be any inflammatory skin conditions which we are ignoring, like our pimples or dandruff or dry skin sensitivities, allergies to chemicals and skincare. So all kinds of this minor inflammation can later give you uneven skin tone. And then the third would be an hormonal imbalance. So it can be like abrupt, it can be very obvious, like they have other signs of hormonal imbalances also. Sometimes can be very subtle also. They may not have an overt hormonal imbalances, but even with normal hormonal changes in females, they can have some pigmentation, like during pregnancy, whether when they have menopause, so like that. So that is one trigger. So these are the common triggers for pigmentation.
Right, right. Now, doctor, can hormonal changes and imbalances lead to hyperpigmentation? If yes, then how?
Hormonal imbalance leading to
Yeah,
hyperpigmentation.
hormonal changes and imbalances.
Yes. So even normal hormonal changes can lead to pigmentation, like how we see this increased pigmentation in pregnancies, and like I said, when they have changes in the cycle. So that is something which can even normally happen. And this hormones can induce some level of inflammation in the skin, which is not very obvious, like in other conditions like pimples or allergies, where we can see this red face, where we have red spots or red rash, later
Yeah.
pigments. But in hormonal induced inflammation, sometimes this phase is like very subtle. This inflammation is not seen, but then later they go directly for pigmentation. So it can induce a subclinical inflammation, and it can also alter the cell cycling. So the cell turnover, everything can be affected, especially when you see this kind of pigmentation. Some young people even now started develop around their neck, and
Okay.
sometimes some males have around here. The skin becomes thicker and they have forehead to side pigmentation. So
Yes,
this is
correct.
not just pigmentation, that is pigmentation and some thickening of skin. This is like an indicator of insulin resistance, like how this is an
Okay.
indicator that this people may go on to develop diabetes later. So this is like an early
Oh,
indicator of hormonal imbalances, like how females,
okay.
we have PCOD where they get hormonal imbalance, or in pregnancy regular
Right.
changes they get a pigmentation. In men and also in women, we can also get as a pre-diabetic indicators, and sometimes they can be face and neck pigmentation. We take it as an indicator. We have to correct the pigmentation, and then along with that also the lifestyle.
Correct, correct, got it. So, doctor, I mean, what are some of the most effective treatments for hyperpigmentation?
So in pigmentation treatment, like I said, we target three areas. Whether we target the production level itself, where the cell is producing that increased pigmentation. So most skin lightening creams will decrease the production by the cell itself, so that
Okay.
where it is produced, it is arrested. So most skin lightening creams containing like kojic acid, arbutin, or botanical extracts, they usually suppress the enzymes which are responsible for producing pigment. So that is one way of addressing pigmentation. The next would be the distribution. Like I said, this pigment producing cell produces pigment, make it into a packet and give it to cells. So we can also decrease that by some creams. And then cell turnover. So like I said, sometimes the cells get with pigment tends to accumulate. They don't renew themselves. So there we can use some exfoliants, like now the famous exfoliants or AHAs, BHAs, like glycolic, salicylic or fruit derived acids, which can somewhat
Okay.
normalize the cell turnover. There can be exfoliation of the dead cells. So that can also give you a glow or a lightening of pigmentation.
Okay.
And the best
Okay.
and the fourth main thing would be again sun protection to retain what we've got from this.
Right. Right. But in general, doctor, a lot of people want to know that is hyperpigmentation treatable? I mean, or
Yes,
is it like
definitely.
something permanent that they're having?
Yes, definitely hyperpigmentation is treatable, but the treatment can
Mhm.
be like very subtle where we just advise some skincare, lighten what is already there, then they can maintain with skincare. But sometimes some people do have some resistant skin diseases where they cannot have a deep pigmentation. There they need
Okay.
professional help. But even in both ends, whether they have mild or whether they have it very severe, it's definitely treatable.
Right. Right. Okay. And that's a good news. A lot of people will be happy to hear that. So now, even after applying, let's say, sunscreen, most people develop hyperpigmentation, right? That's true. But what is the right way to use a sunscreen to protect skin from hyperpigmentation?
Yes, so sun can block out this UV rays, both UVA and B, but it is never 100% even with optimal application. But I find that nobody ever applies it optimally. So like a rough thing, there are many ways to measure how much sunscreen you would need for your face and neck. So that is where commonly we apply our sunscreen. So roughly it would come about 1 to 2 gram. So that means when you get a tube of sunscreen which is about 50 gram, 30 to 50 gram commonly that is the, so you should be using it within a month or 1.5 months. So if you are buying a tube every month or 1.5 months for your face and neck alone, probably maybe you're using somewhat an ideal level of sunscreen use. Anything less than that, then sunscreen application is like very minimal. Sunscreen protection, in spite of what is being given on the label of the sunscreen, it all depends on how you use it. So you can have an SPF 50 sunscreen, but if you are using it like a very thin layer, then that is not going to give you the protection that is given on the box. So the first thing would be to know how much you have to apply for your face and neck. So that would be a rough thing what I said. And then applying it frequently or reapplying it when needed. So some now latest sunscreen they can also last a whole day, but sometimes you will need to reapply it in between for some who sweat a lot or some who are exposed to water. And even with this correct application, sunscreen is not meant for completely avoiding tanning. It is meant for protecting your cell damage from UV rays. So tanning can still occur even with regular sunscreen use. But we have tanning two types. It is an immediate, there is delayed. So this delayed tanning is definitely prevented by sunscreen. But that immediate tanning which we have at the end of the day, when we go out in the sun the whole day, at the end of the day we tend to look a bit dull. So that can happen even with sunscreen use, but that is very temporary, transient, it goes off. To prevent that, we have to use additional physical protection, either in the form of a hat, umbrella, or a physical cover with clothing, so that you don't have that tan to completely block out. So that's why, because we can see when you wear our covered areas, where our sleeves end. So definitely above our sleeves we have a lighter skin tone, and below our sleeves we will definitely have a darker tone. So skin clothing can protect you. And then the third thing would be antioxidants. So whatever damage that has occurred, antioxidants can reverse. So either in the form of cosmeceutical skincare products containing antioxidants or a diet rich in antioxidants that can help.
Right. Right. Wonderful. So, doctor, now how does exfoliation play a role in treating hyperpigmentation? And is it safe for pigmented skin or worsens the condition?
Exfoliation is a very good thing which you can do to your skin regularly, especially as people age. But the thing is, most people either like people who know all about exfoliation and they buy products for that, most of them go overboard. So exfoliation is something which has to be balanced. We just want because with age, in younger age, the turnover where the skin sheds itself and produces new skin is almost perfect. Exfoliation is not needed for very young skin. But as the skin matures, this procedure tends to slow down. So we will need some amount of exfoliation to retain our skin quality like that of a young skin with an even skin tone. But it should be limited. And there are two types of exfoliation. We have physical and chemical. Physical is how we scrubs with the regular particle. Some face washes have some scrub abrasive particles, and then you scrub using some devices. So that is,
Okay.
I would definitely ask people to avoid that and prefer a chemical exfoliation. A chemical is not harmful here. That is just a form of exfoliation. Instead of using a physical rubbing, we are using some ingredients which can do this. So these ingredients are not like harmful chemicals. They are just mostly they are fruit-derived botanical acids like glycolic, salicylic, mandelic, lactic acids. So these they can use. So depending on the type of product you select, if you're going for a glycolic salicylic based exfoliation, I think it would be best to limit it to thrice a week. If you're going for milder exfoliations like lactic acids or gluconolactone, you can use it for even daily. And
Okay.
if you're going
Right.
for professional exfoliation or leave-in exfoliating serums, it is best for serums once a week and professional at least once in 2 weeks or 3 weeks, not more than that.
Right. 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 So, doctor, now you were telling about the ingredients that they should use for exfoliation. Why not we also, inform our listeners about some ingredients that they should consider while choosing a sunscreen? We had covered that in our one of the previous Instagram live sessions as well. But just to remind them, okay, what ingredients they should look for in a good sunscreen.
So sunscreen similarly has physical and chemical ingredients, but the physical here is the type of protection it offers, not the physical cover with some other external thing, but the type of protection it offers, because physical sunscreen just coat your skin and then block out all the rays. So chemical
Yeah.
sunscreen can absorb the rays and then reflect it back. So we have two kinds of ingredients that will be listed on the back of any sunscreen pack people purchase. So some
Right.
sunscreens can be purely physical too. They only have micronized zinc oxide or titanium oxide. So nowadays we get this pure sunscreen, physical sunscreen. The previous version of this pure physical sunscreen was cricketers applying this white paste, which was a zinc paste.
Yeah. Yeah.
Thankfully, now we have this micro zinc, so we need not have this cast appearance, but the
Right.
protection is the same. So we can go for physical pure sunscreen, especially for people with sensitive skin and especially pregnant people and children. So they can go for this. And chemical
Okay.
sunscreen is more broader. It can also absorb and reflect the sun. So most of the sunscreens are blend of both. The chemical sunscreen, we have many. The list is ever expanding. New molecules are coming up. We have juvenile, tinosaur, many things. But instead of telling you what you should look for, I can tell you what you should avoid, because some products have become outdated now. The newer products are coming. So the list would be very big for anyone to remember all the chemical names. But the the ingredients to avoid, I think, would be the cinnamate based or a benzophenone or a benzones based. So that can be avoided because we have multiple other new molecules which can fill the space. Previously, it was mainly based on that. Now we find there are some reports issues with this. So you can avoid
Okay.
benzones and cinnamates.
Right. Right. Okay. Now, doctor, can certain skincare ingredients like hydroquinone or retinol help fade the hyperpigmentation? And then, how to choose products containing safe skin lightening ingredients?
So skin lightening in India, especially in rural population, I would say skin lightening is limited to an OTC product they get from pharmacy, which is filled with steroids and hydroquinone and retinol, which comes in a combination that people purchase and then apply on their face. That lightens very much. I have to say the lightening would be dramatic in the first 1 month, but that is going to give you the most, the worst thing you can do for your skin is that because
Oh my God.
of the level of lack of knowledge, many people use that cream containing because even there are many YouTube videos, influencers telling about this combination giving you a bright skin. We want
Right.
a healthy and bright skin. We do not want just a light
Yes.
skin. So the
Correct.
lightening you get should not come at the cost of damaging your skin. So
Yeah.
I think it would be best to steer clear of products containing hydroquinone, steroids. Retinol is safe provided you know how to use it, because
Okay.
there are many people who are intolerant to many forms of retinols. The skin can become very dry, and it can also irritate skin to some extent. So I would prefer people keep hydroquinone, retinol as a prescription product. It is not like a skincare product. So there are
Okay.
many more safe skin lightening agents out there which are used in our skincare products and also available separately, like kojic acid, arbutin, licorice extracts, some vitamin C, all this glycolic salicylic acid, which
Yeah.
some good combination in good companies can give you good results along with the sunscreen. Never ever go for hydroquinone or retinol self-medication. They are wonderful molecules, but they should be handled by a dermatologist. They should be used
Understood.
supervised by a dermatologist.
Right. Right. So guys, do visit a dermatologist before choosing your product, especially if they are for skin lightening. I mean, there can be a lot of unhealthy chemicals in them which are not good for your daily use, because a lot of companies use certain marketing to attract you to purchase those products, but in the long run, as doctor said, they're not good for you. So go visit a dermatologist, and they're the best people to inform you. But in general, as doctor mentioned, avoid hydroquinone, right, doctor?
Yes.
Yeah, right. Now, moving on, doctor, next question. What are some potential side effects or risk associated with, using skincare? You mentioned some, right? For hyperpigmentation, like if people continue using these OTC products which are not good for them, what could be the potential side effects?
So initially for 1 month or two, the skin would look very good. People will compliment them on
Yeah.
how bright they are looking and how because since it sometimes also contains steroids, it can, like I said, inflammation is an inciting factor for pigmentation. So the steroid is an anti-inflammatory agent. So they use this steroid, so all that inflammation also comes down in the beginning. All the pimples and that sensitivity, everything decreases, and they also have lightening because of hydroquinone. So for the 1 month or two, everything is fine. They don't so they kind of get used to it. But then time comes, because inflammatory skin conditions are to be treated. They should not be suppressed. So acne should be treated as acne should be treated. We cannot
Yeah.
just, because acne, inflammation is one part of acne. There is also an infective agent there. So we'll also have to treat that. So if they use this
Correct.
just plain anti-inflammatory steroid creams, so there is just suppression. There is no reduction or cure. It's not just visible. That's all. So at some point, when they try to stop using that cream, it all comes back with a vengeance, is what I would say, because they come immediately with a full face of all kind of irritation, allergies, a flare of pimples within few days of stopping this cream. So then they now cannot stop it. They have to go back to it. So when they go back again, they become better for some time.
Yeah.
So they keep using
Okay.
it. But after some time, even with using, while you're on that, other side effects starts to appear. So the skin becomes kind of thin, and even the along with the lightening, they also get kind of pink skin tone. The skin becomes more reddish, like a blush.
Okay.
So as the skin thins, the vasculature, the blood vessels under the skin is visible more. So they get this red
Right.
hue. They become more pink instead of white.
Mhm.
So and then
Yeah.
so even while using, the skin will thin, and they cannot tolerate any other skin product. Even if you wash your
Mhm.
face a little vigorously, you will have like a burning sensation and irritation post. So
Mhm.
these kinds of skin signs will start to develop. Then they can also get some hair growth on the skin. And at some
Mhm.
point after 6 months or 1 year, they are just done into this. So whether they use or whether they stop, the skin will keep on damaging.
Understood.
It
So
is
it's
best to consult a dermatologist if you have gone into
right.
this to safe way to withdraw from the screen.
Correct. So you should go and visit a dermatologist and let them do their job rather than you doing experimenting at home and trying products which are not good for you, right? So with this, I would like to thank Dr. Shanmuga Priya for joining us today. It's been a wonderful session, I believe. Immense help for lot of people, housewife, gentlemen, professional people who would want to look good, take care of their skin routines because they want to go out or look good in general. So I'm sure this is of great help to everyone. Guys, if you've got any question for any health expert, dermatologist or orthopedics or any specific concern for the body, you can connect for free on our WhatsApp platform on Cureka. Our care team experts will connect with the specialist doctors like Dr. Shanmuga Priya and come back to you with their responses. So do feel free to connect with us, and we have got a lot of products which are in general very good for your healthy living. All these products are handpicked by a team of expert doctors at Cureka. Do check them out and give us a try. Give us a one shot at choosing products in Cureka and see how's the response. And you can let us know about your feedback. A lot of people have given us a lot of love and affection, and we are keeping on improving ourselves. We are an Indian company who's trying to grow big. Please support us and do let us know your responses. So thank you, doctor. It's been a wonderful session, and we look forward to connecting with you again.
Thank you.
Thank you, doctor. Thanks a lot.